Hi, so today we are talking about diastasis recti. Diastasis is when there is a separation between the muscle bellies in the abdomen. There is a common misconception that once it happens, it is there for life, or that you have to then be wearing belly binders or something of the sort to address it. We now know that through some really specific core strengthening and breath work, we can actually help to close that diastasis down, which helps with your core function, which helps with your posture, and also it just makes you feel better when you have a little bit more security at your core when you're doing functional movement like getting your baby out of the car seat. So I'm going to take you guys through my favorite starter pack exercises for diastasis today. With your 360 breath, you want your ribs to move laterally and your stomach to move forward to get nice, good expansion at the ribs. Gently using your hands, you can actually push on the muscles and on the ribs to get a little bit of approximation at the muscle, which helps to remind the muscles where they need to be firing. Mastering this breath is really going to be your first foundational building block with any of the diastasis exercises you do. Moving on to the pelvic tilt with heel slide, you're bringing your hips back, pressing low back to the ground, and then gently alternating which leg you're moving out. When you move your leg out, it adds a challenge to your core to have to keep that low back pressed to the table. For abdominal wrapping, you utilize your exhale to get a really good core contraction. So here I'm taking good deep breaths in, and then as I exhale, I'm also using a ball for a little bit of added resistance, just to get a little more juice for my squeeze of my abdominal contraction. Your breath is also going to help control the pressure in your abdomen. By exhaling during your powerful part of your movement, or the standing motion during your squat, you make your mouth the point of least resistance for any abdominal pressure rather than the diastasis. This helps prevent the pressure from making the diastasis worse. Additionally, we can use some K-tape just to help to remind those muscles exactly where they're supposed to be firing. So here I'm using a crisscross technique where I am laying the tape crisscrossed over each other in an upward direction. This really just gives good neuromuscular input to the muscles, again, just to remind them of what their job is and where they're supposed to be working for you. If the diastasis is severe enough, this can also help feel a little bit more secure there. And here's just the crisscross pattern laid over it.